All right. Hello, everybody.
Hi.
Hey, my name is Tatiana, and I am a program coordinator for Northeastern Community Action Partnership. It is a New York State Oasis Addictions Resource Center. So we provide resources and support and information in regarding substance use disorder, for prevention, treatment, recovery, addictions, mental health resources and support, and all of that. And tonight, our community presentation is about collaborating and unifying substance use disorder and support with mental health as well, and utilizing that in our community and providing support and resources for families all throughout Albany County, Capital District, and New York State. So our presenters tonight are two lovely colleagues of mine from CHAMP program and my colleague from the Addictions Care Center of Albany at our Family Support Navigator. So our CHAMP colleagues is Lynn Goldberg and Stephanie Campbell. Welcome. And from ACCA is Dan McLarney, our Family Support Navigator. So with Northeastern Community Action Partnership, we want to highlight our partners, show you all what we're doing and working so hard to support our community, and to let you know that, yeah, we collaborate together and there's so many amazing resources that are available. So I would love to spotlight Lynn and Stephanie from CHAMP to talk more about their program. Take it away.
Wonderful. Well, hello, everyone, and welcome. It's so great to see some familiar faces, and it's an honor and a privilege for Lynn and I to be here. Just want to start off by introducing myself. My name is Stephanie Campbell. I am the director of the New York State Behavioral Health Ombudsman Office, also known as the Community Health Access to Addiction and Mental Health Care Project, CHAMP. And, but more importantly, I'm a person, my name is Stephanie Campbell, and I'm a person in sustained recovery. And what that means for me is, you know, I've been on this journey to recovery since March of 1989. It's just been an extraordinary journey. So really grateful to be here. And as some of you know, I was the executive director of Friends of Recovery New York before I was asked by the former general counsel of Oasis and Emil Slane, who is the CFO at OMH, to come over and oversee the Ombudsman office. And in 2018, the executive budget had established the Office of the Independent Substance Use Disorder and Mental Health Ombudsman Program, known, as I mentioned to you, as CHAMP, to assist individuals with substance use and mental health issues to use their insurance, health insurance coverage in order to identify, investigate, refer and resolve complaints that are made by or on behalf of individuals and providers regarding their insurance benefits. And the program is also charged with helping substance use and mental health providers resolve their patients' insurance issues. And so in 2018, I came on board and Lynn came on board as one of the specialists, the designated specialists. The program is actually, we contracted out to Community Service Society of New York, CSS, and 3 specialists, of which Lynn's organization, the New York State Council for Community Behavioral Health Care, is one of them. We also contracted out with the Legal Action Center and Medicare Rights Center. And these are all, you know, statewide organizations that, and national organizations that are known to specialize, provide technical assistance, work on insurance issues, as well as SUD and mental health advocacy and policy efforts. And we also have 5 regional community-based organizations, CBOs, that serve in different regions of the state in order to, really help provide individualized, regionalized support for folks that need access to care. And in the northern part of the state, AHI is the Adirondack Health Institute. On Staten Island, we've got CHASI, the Community Health Action of Staten Island. We also have on the western part of the state, Family and Children's Association down on Long Island. On the western part of the state, Saving the Michaels of the World. And then in the central part of the state, Family Counseling Services of Cortland County. So these are the 5 community-based regional organizations that help provide work on cases, take calls on a local level. And then we have a statewide helpline. And that helpline is maintained through CSS down in, based in New York City, but they take calls from all over the state. Actually, we've had folks from outside of New York State who have called the CHAMP helpline. And that number is 888-614-5400. But the other, New York State recognized, the governor funded, and the legislature funded this initiative, and it was designed for insurance related issues. It's turned into something much more, as many initiatives are. It is the first in the nation of a New York State, or the first of a nation of a behavioral health ombudsman office. But Lynn and I, and Lynn's going to talk a little bit about, some examples of the cases that we've received, some of the issues. And also Dan and I've had the honor and the privilege of working with Dan on some of these issues. But oftentimes, I'm working, my role as the director of this is obviously to oversee the program, but also to work with the specialists, work with our regional partners on systemic issues, access to care issues, particularly, since the advent of COVID, we've seen, a real surge in the number of cases that folks who are, desperate to get access to care, are reaching out. And, and I'm fortunate to have, folks like Dan who will, who know to contact me and to try to help resolve some of those barriers to care. Sometimes those barriers to care, can include issues. For example, we know that addiction is not a 9 to 5, a 9 to 5 illness, and mental health. It's not a 9 to 5 illness. And so sometimes, on evenings and, on weekends, we have folks that desperately, desperately need help. Perhaps, an individual needs detox, but doesn't want to go into their local emergency room, because of fear of contracting COVID, but need CHAMP's help in finding a detox program that's covered by their insurance. Perhaps there's an individual who needs help finding a provider who takes their insurance. And I know, Lynn can talk a little bit about some of those examples that she's worked very closely with me on as well. Perhaps an insurer had provided prior authorization for an individual to receive inpatient SUD treatment, but then rescinded their prior authorization a day later. And, the client was, once the individual was already in treatment. Or maybe there's an insurer who's refusing to approve more than 14 days of inpatient treatment, even though the provider had determined that there were more days that were medically necessary. We've also had, on the mental health side, we've had individuals who are seeking treatment for their eating disorder, but Medicaid doesn't cover this kind of treatment in New York State, a kind of residential longer term treatment. We've also had individuals, and I've worked with Lynn on these cases, where they needed psychiatric medication, but they couldn't get an appointment with an in-network provider quickly enough before their medication was going to run out. And so, we have to scramble to try to find that person the care that they need, when they need it. Or if an individual is even uninsured, but needs treatment for, an addiction-related or mental health condition, or that the, insurer is denying coverage treatment, saying that it's not medically necessary. These are all examples of ways in which, Lynn and myself and Dan and the many specialists and the specialists and the advocates around the state are working together to really try to get access to care, in the moment when it's, or as quickly to that, treatment on demand. As advocates, we had long, noted that, we can make lots of, changes to legislation, and we can make lots of changes to regulation and issue guidance. But in the moment, with our population, with our recovery, our folks in need of recovery, whether it's on the substance use side or the mental health side, because we know that there's a lot of comorbidity on both of those sides, and we don't necessarily know sometimes which came first, the chicken or the egg. But the important piece is that we get folks the care that they need when they need it, and that we help families who are in crisis themselves, watching their loved one suffer, that we help that, that family get care, when they need it. So I'm happy to say that, in the course of the last, a little over 2 years, we have, we've served over 3,000 individuals who have called, the helpline and worked with myself and the rest of the team. We've helped over 3,000 people get the care that they need. And that's just absolutely, life-saving for many of these folks. And the last thing I want to say is that, aside from the real-time, in the trench work that's being done with our extraordinary advocates and the specialists and the the CBOs, the information that the data that's being collected, the conversations that I'm having with our partners, I'm taking to our the state. I'm having conversations with OASIS and OMH and DFS, which is the Department of Financial Services, and the Department of Health, as well as other state agencies, to really try to find solutions for some of these systemic issues that keep repeating themselves. And so the data that we're collecting, we submit monthly reports to the state. We go over those systemic issues, and we're having conversations and really looking for solutions, including right now we're working on parity enforcement to make sure that insurers are paying on par claims that are submitted on both in par on the mental health side and the substance use treatment side, on par with what's happening on the medical surgical side. And we know that historically our folks on the behavioral health, seeking behavioral health, have been egregiously denied the same level of care that they, had they not been diagnosed with a mental health or substance use issue, and had that been a medical or surgical issue, that their payers, the insurance that they've paid into, or the taxpayers here in New York State have paid into, would have covered those benefits. So we're really working hard to address, you know, that disparity and make sure that, you know, individuals and their families get the treatment that they deserve, that it's high quality, and that it's for the amount of time that they need, at the right level of care, for the amount of time that they need it. So really grateful to be here again and have the opportunity to share with you all. And I'm going to turn it over to Lynn.
Thank you.
Thanks, Stephanie. That was great information. And I'll just follow up with a little bit more because I know we also want to have an opportunity to dialogue with you. So I'm Lynn Goldberg. I work with an advocacy organization called the New York State Council for Community Behavioral Health Care. And our organization provides information, support, and legislative interpretation to a lot of organizations around the state who provide mental health and addiction care services. But I was brought on board, as Stephanie said, in 2018 as the project specialist for the CHAMP program. So my role is a little bit unique in the organization. I am dedicated to CHAMP in my role, and I work as a consultant with and trainer within the project, helping all of the organizations that are involved to be able to respond to the mental health and substance use disorder concerns of clients who call in. And I also provide a great deal of community outreach. So I'm very grateful to Tatiana and the Addiction Care Center to allowing us to present today, because this is the way that Stephanie and I and our organization get the word out about this resource. So what I want to just add to what Stephanie said is that CHAMP is something that any of you and your organizations and your colleagues, your clients, the individuals you work with and support can use to be able to overcome barriers to accessing mental health and addiction care. So that phone number that Stephanie gave, the CHAMP helpline, 888-614-5400, it's in the chat box. It's also on the PowerPoint slide that Tatiana included in the chat, and it's widely available. That's a number that you can call. You can facilitate a phone call with people that you're working with. If individuals in your family, a person can call on their own behalf. Anyone can contact the CHAMP helpline. It is an actual, well, pre-COVID, it was a place in New York City. Now it's individuals all around New York who are working from home, but still working very hard to answer the calls and respond to the needs of individuals. CHAMP is for anyone in New York, regardless of their age, regardless of their insurance type or Medicaid. As Stephanie said, they could be uninsured, and in addition to helping them get access to care, we'll connect them to other resources to help them get enrolled in appropriate coverage. Also, regardless of their immigration status, we work across the board from children to individuals who are recipients of Medicare. So we are very fortunate to work with the Medicare Rights Center to help us understand the rights of individuals with Medicare as well, because they're different. We're very much concerned with access to care, and we recognize, as does the state, that there are many times, much of the time, the barriers to accessing care relate directly or indirectly to insurance issues. So we do get calls for a variety of concerns. It could be all of those that Stephanie mentioned. It could also be that you might be working with someone who was maybe inpatient for a mental health concern, and they were prescribed a medication while they were in the hospital that was working really well for them to control their symptoms. But when they were discharged, they were told by their insurance company that they don't cover that they don't cover that medication. So it's not a simple one answer fits everyone, but we work with, we might contact the insurance company, we might work with the provider to look at it could be that other medications might be appropriate for the person. It could be that they're being denied this medication inappropriately and they're violating that person's rights. There could be all various concerns involved with it, and the CHAMP helpline and all of us as specialists will take the time to kind of look into it, find out what's going on, and help resolve it for that person as quickly as possible. Sometimes the individual needs specialized care, someone who is seeking, say, treatment for something like OCD, which can have very specialized treatment options for, or as I think Stephanie mentioned, eating disorders. That's a big concern. We have a lot of mental health facilities around the country, around the state rather, who are designated as centers of excellence for eating disorder care, but over the years, we've had challenges with those organizations. So we're working together to shore up the programs that are not directly working to shore them up, but to provide the feedback so that we can try to ensure that people can get the level of care that they need at the time that they need it. Also, many times, the kinds of concerns that I get called about are when an individual might have dual concerns, whether they be physical health, mental health, and addiction care concerns, or all three, couple of them. Many times, if someone has co-occurring mental health and addiction concerns, they have difficulty getting into treatment. Someone maybe had a recent inpatient stay for mental health concerns, and now the inpatient substance use disorder programs are denying them access to care, saying that they can't take care of them. Even though all of the programs in the state, many of them will say they can manage both mental health and addiction, it's very common in our experience for them to be denied care. So we might get involved and try to help advocate or locate programs that would be appropriate for that person. So I think we've covered it all. What happens, I wanted to tell you, so if you have someone that you're sitting with who needs care, you're working with them and they are not able to get what they need, you can say, let's call CHAMP. This is a resource, it's free, it's available to you. You can pick up the phone and help them make the call. They can give verbal permission during the course of that call for you to speak with them. And they will be actually reaching a live person once you call the CHAMP helpline, and then there's a specific option for the CHAMP helpline itself. That number goes right into CSS and all of their programs. Then they will reach it typically will be an attorney or a social worker, depends on who picks up the phone. Some of you who have called know Geneva. Dan and I have talked about Geneva. She's one of the social workers, and she's great, and they're all great. And they will take the time to listen and find out what the concern is, and either offer resources and information if that will handle the issue, or work to resolve it as quickly as possible. And I could tell you, excuse me, that they're not going to stop until there's some resolution. Mm-hmm. And sometimes, as Stephanie said, there isn't a resolution that's fabulous because the existing, existing programs or resources or legislation don't support that individual to get what they believe they need or their providers think they need. So we work on that too at a higher level.
Oh, that's really
talking
amazing.
right now because I'm breathing in attic dust here.
Okay, make sure that you're healthy. So knowing just this is like confidential, this is free, you don't give up, where someone can call this helpline and actually talk to someone.
Talk to a person. It is 9 to 4, Monday through Friday. There is a confidential voicemail. There's also the email address that Stephanie provided in the chat, ombuds@oasis.ny.gov. That can be contacted anytime. That actually goes to Stephanie, who monitors that, I believe. You can correct me if I'm wrong. And all of us kind of, all of us take a role in responding to the concerns.
Wow. Wow. Thank you
Yeah,
so much
there's
for
also
providing all
on
this
the
information.
weekend. Oh, I'm sorry. Also, you know, Dan will probably talk a little bit about this, but I also put my cell phone number in the text box because on the weekends I am available if folks you know need emergency you know an emergency response, and I work with folks on the weekends. So that number is in the text box as well.
Thank you so much. So going to Dan McLarney, Addictions Care Center Family Support Navigator. You've used CHAMP, correct?
That's, yeah. I've been doing this about the Family Support Navigator part for almost 3 years now. And CHAMP, like Stephanie said, a little over 2 years. And I use them regularly. I have them on speed dial, the 888-614-5400.
Wow.
I could, as soon as last Thursday, same thing. I had a mother call in crisis, her son, and he had no insurance. So it's such a great resource when I could just call. Like you said, I usually, I don't know how I always get Geneva. Like 90% of the time I get this woman, Geneva, who's just wonderful. But they take right over, and it's, you know, it's one, I think the big thing is that our resource is totally free, and then their resource is totally free, and so that's a burden these families don't have right off the top, you know. And within that same day, this fellow, it was the only place that would take him that night was in St. Lawrence, 5 hours away, and his family got him there that night, and he had a bed that same night on Thursday. So with no insurance, and this is, you know, I'm also a person in long-term sustained recovery, and I think the family part, the part that I'm able to do here at ACCA and CHAMP, we're so needed in this, you know. So a little bit about myself too. So I'm a SERPA, you know, Certified Recovery Peer Advocate. I got my F for family endorsement now, to work with families. So like the slide up here says, we aid the families in achieving services. We educate, we advocate. So the biggest thing, provide direction, answers, as well as steps to take when a loved one is suffering from substance use disorders. Support and resources for when the loved one completed treatment. So we'll get family members who call, and so the first thing is they're just, a lot of times they have no idea what substance use disorder, or they don't know if their child is doing substances. So they just have questions. So we have a range from people who, you know, need treatment right away to people that would just come in, and we'll sit and talk with them and find out where they're at with their substance use disorder. And sometimes the person with the substance use disorder doesn't even get involved. We just work with the family, and we actually have somebody who's qualified with craft now, so we work towards getting that person motivated to get help. But if they don't, we have a support group that we run every Monday at 6:30. Now it's via Zoom, which is thank goodness that we have this venue. I mean, I'm an in-person person. I like to be, you know, one-on-one, the huggy feely guy, but Zoom has done its job. I mean, we still get 15 to 20 people every week, family members, and it's just support. That's all it really is we give a little education if they ask on the disease of addiction, but it's really just families knowing that this other family is going through something similar. You know, our loved ones want to help and they're there, but a family, I think, that has been through it really knows what that other family is going through, you know, because it's easy to say, oh, just throw Johnny out, or just do the, you know, and it's not that simple. You know, we love our people, and we just want the best help for them. So that's, as a family navigator, I get to do this awesome job. I even told my director one time, like, I do this for free, right? We love this. And then So just here to help families establish relief and wellness, giving members alternatives, options, helping their loved ones and providing information and education, referrals to families to work towards a healthy and recovery-oriented lifestyle. So it's just a daily thing. Some families, you know, it's a one-time call, just a referral to treatment or to Al-Anon or Nar-Anon or Gamblers Anonymous. I mean, we refer everywhere. And then other times we have families that have been with us for over 2 years that just, you know, continue, their person still suffering or their person had a reoccurrence and they come back to us. And we're here, and it's, you know, and to have CHAMP, that's, because like I say, I'm only as good as my resources and referrals. And Stephanie, like, I have that 888 number, but on the weekends and nights, I have Stephanie's cell number, and we'll use it. You know, we don't. It's addiction isn't 9 to 5, and we know that's, you know, us that do this. And sometimes we have a little window of opportunity to get that person the help they need, and you know, we got to really, you know, get it together. And prior to these, you know, insurance was such a huge barrier. If you didn't have insurance, you were kind of stranded, unless you went to an emergency room. And, you know, you go to an emergency room and you go in there for substance use, you're there. You know, first comes brain injuries and heart and everything, and then addiction tends to come. So you'll sit there all day now, where, you know, there's facilities and treatment centers that are willing to detox you right then and there. And so just connecting with a resource like CHAMP and then having this family support where we refer everywhere. It doesn't matter. I work for the Addiction Care Center, but it's very rarely I refer to the Addiction Care Center. It seems like I refer throughout the state. So once again, that's what I've been doing for the last almost 3 years now. My information's down there. Yeah, and I just, if anyone, my number's there. We're accessible. I check my phone, even the work phone, over the weekends. So nobody waits more than 24 hours maximum before I get back to anybody. But yeah, I'm here, and thank you.
Thank you so much, Dan. Would anyone like to project any questions, like community questions? I know that, you know, sometimes when someone goes in for substance use disorder and is seeking treatment, you know, there is that co-occurring, but they're not aware of it until they go in to treatment, right? So is that, like, a lot of people don't really know whether there are co-occurring, you know, so like, unless, you know, they get a diagnosis, right? Is that like, that's why they're trying to combine the mental health and substance use disorder and join them together because of that access of care, like the overall, like, holistic approach?
Yeah, I think if I may address that, and Lynn is the licensed clinical person here, so I'm going to also defer to her expertise. But quite frankly, there is you know, a number of individuals who we don't know if it came first, the chicken or the egg, you know, and oftentimes it's, you know, simultaneous issues that you know, that folks are really struggling with. So we need to be able to, you know, get folks a diagnosis. If they are using substances, then, you know, we can do a locator assessment. We can have someone assess them either over the phone. That there's a number of, you know, resources available, including the Cody projects. But we also, you know, have additional assessments that can be done on the mental health side if it is, you know, strictly mental health. So, Lynn, did you want to add anything to that?
Yeah, I mean, just to clarify that we ourselves are not treatment providers, and we're not going to be doing the assessments, but you as community providers will kind of contact us, or individuals will contact us with their presenting concern. So many times the presenting concern is about an issue of getting mental health services and addiction care services. I think, Tatiana, you're pointing to like a broader issue, which is really important about, treating the whole person. And that's definitely like a philosophy that we would support, but we're not treating them. We're going to just respond to wherever that person is in that time, and with regard to what their providers requesting of us to try to help get them what they need. At the same time, Stephanie's working at the state level and with, in a more policy related way to try to help ensure that services are continuing to get more and more integrated. It's been years and years that I've been working, and integrating mental health and addiction care has been a challenge, but I think that, there's some changes coming down the pike that I think will address that. But as Stephanie said, we have connections, and working with OASIS and OMH, Stephanie can, contact Cody or, work with you to help bridge the gaps that the individuals are seeing. But we ourselves are not going to we're not going to assess the person's need, and we're not going to diagnose them, but we're going to work with you to try to get the person to the right place so they can get that support and get that, whatever they might be needing. Did that answer your question?
Yes.
Okay.
Thank you. Yeah, it's just because not being in this industry, working in the addictions field, you don't really think that addiction can possibly be under mental health. No one likes to talk about any of this stuff. So it is important to have these community presentations to know what is available in your community. And this is not just in Albany. This is not just in the capital region. These services go beyond that. So if you know any family member or anyone who might be struggling with substance use disorder or mental health struggles, please feel free to contact us, whether it's calling directly the CHAMP helpline or contacting Dan for family support, because we all work together to help the community on multiple levels. And just knowing that these services are available, just asking a simple question. You can just call and ask us a question or email someone. You don't have to dive in and talk about your experiences and your story right away. So please don't feed into that stigma and those stereotypes, and please don't suffer in silence. Because so many people do. I know a lot in my family as well. We suffered in silence, and enough is enough. Our loved one is more important than thinking that guilt and shame, those emotions taking over. So it's extremely important to have you all advocates in the community. And there is a question in the chat that says, is there a community-based organization in the Northeast region? Stephanie did mention various CBOs across the state.
Yep, Stephanie mentioned Adirondack Health Institute, which is, or AHI, which is kind of in the Glens Falls area and up north. They have a pretty broad region, broad footprint in that region, and they're our CBO. And if you would like us, we can give you the direct contact information for them too.
Great. Yeah, we can definitely put that in the chat. And know that, anyone who needs, has any questions after this presentation, once you just listen to these, our wonderful partners in this organization that we have here, your mind starts going, right? After you listen to this, you'll start applying things. So if you ever are in need of information after listening to this, please feel free to visit our website, northeasterncap.com. We are New York State OASIS resource for addictions, and whether it's substance abuse, gambling, mental health, we try to help our community as much as possible. Would anyone in the Zoom like to share anything or ask any questions or introduce yourself before we sign off? Or any comments? And that's totally okay if you don't like to, but
Tatiana, I'll just say,
yes.
this is a fantastic presentation. I'm familiar with both organizations and have made referrals to both. And I think they're both fantastic resources. And thank you so much for doing this. You know, I learned something new again tonight by listening again. So thank you all very much. This is a wonderful opportunity to learn about, you know, like you said, the important resources that are out there for everybody. So thank you.
It's always great to see you, Brandy. Thank you.
Thank you, Brandy.
Brandy's with the problem gambling resource center, and very important resource as well.
Thank you.
Yeah, and you'll be our next community presentation. I'm putting you on the spotlight next.
I'm looking forward to it. Although I'm not going to follow these guys. I don't think I can do that.
Oh, stop. I'm putting the link for the CHAMP program at AHI into the chat box.
Thank you.
Sure.
Thank you so much, Stephanie. Thank you so much, Lynn and Dan. I really, really appreciate you taking the time and energy to present this to our communities. And just to let everyone know, if you have any questions, feel free to visit our website, northeasterncap.com. You can email us and I can get you Lynn, Stephanie, and Dan's information, and hope to see you all soon. Thank you all so much for joining us tonight.
Thank you so much.
Thank you, everyone.
Take care.
Take care.
Thank you. Have a
Thank you
great
so much,
night.
Donna.
Bye,
Bye-bye.
everybody.
Good night.